Mary Rhodes, standing by. Good morning, Mary.
Day, good morning.
Good morning.
Let's just start with the refined executive order. I'm still getting messages from businesses, Mary, and I don't know if they're GHRA members or whatever, but I'm getting these messages and they're asking about the first executive order, the unrefined one, the pure and uncut. And they're still under the impression that they got to be checking people's vaccination status. Maybe they were sleeping when the new executive order came out.
Yeah, so with the revised executive order, all you have to do is provide the contact tracing list for check-in, and then you can either give instructions or have somebody ask, right, if they have the vaccine passport or vaccine documents, and if not, they have to, and if they've been tested once, if they received their immunization once, or they lost their card, then they can sign in and self-attest that they've lost their card. But if you can actually do it just by having the instructions and the form, because in our meeting with the governor on Monday, it was very clear that, and I think Chima and Tom Nadeau were both on your show that day, where they said that their process is 5 days minimum in getting people their CDC cards, or even to consider the exemption. And so that's a long time to wait for, and then imagine with all their other requests and all their other duties. So that was basically the consideration given that, that they are going to have delays in this. So it's much easier to implement this self-attestation so that you don't have to really interact with the guest if not necessary, where you can actually just put it on a sign or put it on your sign-in sheet on the top of the form and says, please check in and check mark either you have your vaccine card with you or you self-attest that you do not have it with you, and or if you have it, if you have your first dose. So it's really up to the individual to attest on those things. And so that alleviates the businesses from really asking the question and just having that check-in process,
I want to ask a question on that. So it does alleviate the businesses, but it places a whole lot of faith on the honor system. So I just want to ask, just as the head of GHRA, from a public health standpoint, when you put on your concerned citizen hat, do you think that this is going to do anything to prevent the transmission? Do you think that it's going to present problems with contact tracing and all that other stuff that public health needs to run down these clusters?
Well, we actually ran through scenarios, right, last week, Thursday, when I did meet with them when they were drafting the initial one. And that was the challenge, because unless you have something that is electronic, there's no way to track this. And in my conversation with them, they said, well, what's the difference with the contact tracing list? You know, we've seen different contact tracing lists, and we don't know whether or not that information is purely accurate with phone numbers and all of that. But there is, again, the responsibility of the community, not just the business, but also the individuals. And that's what it comes down to, is if public health is not able to efficiently and effectively provide these documentations with regards to replacement CDC cards, or get people in time to get them back to work, or even to want to participate in the community as far as in dining or going to a gym or doing whatever social activities that are limited at this time, then it's really up to the individual to have that responsibility to either stay at home, make choices, or when they do come out, be ready to self-attest. Because all of the establishments should just really simplify their process and have that there, because again, it alleviates that. And I was very moved in that interview you had with Mo from Mosa's, and it was very hard to see that, because that was really the reaction the next day after everybody had seen that, is after dealing with challenges of implementing on day one, Monday, even though it's not enforceable, that shows how businesses take this very seriously when changes are made and they effectuate change, and how it impacts the community. And it's unfortunate that immediate changes like this based on very quick decisions and fast implementation dates, and without it going through the operational process and knowing how, the domino effect of this, it really causes a lot of stress, a lot of concern, unnecessary, challenges for everybody. And it's really hard when you're working and having to change operations and with educating people in the community, but also getting your staff ready to deal with that is just extremely hard. And giving them more responsibility when everybody is afraid, right? So it's just, it actually was the only way to alleviate the businesses of having to ask that question without really having the liability issues, right? So I think it was a way out for, really for the gov and public health and to have to answer to the CDC and exemption questions, and again, put personal responsibility to people who are choosing to have activities.
We had Chamber on Kathy yesterday, and even despite the refined executive order, the Chamber still stands and holds a position that they want to see a full rescinding of the executive orders. What is the GHRA's position?
Yeah, absolutely. When we met with her Monday, it was actually after my interview with you on Monday. And in that meeting, we did ask again about going back to the 50% occupancy for all business sectors, right? Not just dine-in, for all business sectors. And keeping gathering at 25, especially as you heard earlier today with Chima and Public Health. Right now, with the challenges in contact tracing and people not actively using the Guam COVID Alert app, you have to understand that if it's community spread, then they really do have to limit gatherings. If they cannot put it on one type of industry or one part of the business sector, then why do we have limitations to certain types of businesses? It should be across the board. We should have limited gatherings at 25 as originally recommended by the PAG as well as GHRA. Limit gatherings to 25 until this surge is over. It's a reasonable request knowing that it's community transmission. They're not going back and really taking the interviews of, let's say, those 126 people last night, how far it goes back to that index patient, right? When they were PUIs at that point, persons under, of interest and under investigation of contact tracing. So they're not going all the way back. They're not peeling the layers of all of that. What they're doing is just, where have you been the last several days? And unfortunately, people aren't getting notified fast enough, or people aren't using the Guam COVID Alert app. So if you're not going to continuing going down that road using those systems you put in place, then what is the solution? And I know you guys asked that to Chima. And to us, you limit gatherings, because if you don't have you can't put a finger on where it's really coming from or who the index patients are, then we should just go back to 25 for gatherings until the surge is over. It's the responsible thing to do, and it's fair across the board.
So you met with the governor, that was Monday before the refined executive order came out?
Yes, we had a meeting with the governor at 9:30, right after our interview with you, and we talked about 50% occupancy, like where we were, or even 75% occupancy where we were before the lifting of restrictions. We even talked about outdoor dining. I know that they reference, San Francisco. Outdoor dining is allowed for unvaccinated in San Francisco. And so there are a lot of options that we still brought up again on the table. And so the only things that they reconsidered was allowing self-attestation because of the difficulty to get documentation out to individuals, whether it's your CDC card or your exemption. And then actually that really helps employers as well as businesses to not ask about your exemption, right? And so there are liabilities with even asking those questions. So it's much better to do self-attestation, and it's up to you to get your documents squared away with public health, but you have to attest to that. And so the other thing that we asked for, which they did change, is the testing requirements for employees. They changed it from PCR test to just a test. And I'm asking that they really consider what we implemented back in December 2020, which is the rapid testing, the Binax cards of 15 minutes, because we cannot ask to put more stressors on public health, as you already know, and we cannot wait 24 to 48 hours for results. And if contact tracing is several days, 6 days into it, plus the notification of 24 to 48 hours of your test results, it just makes sense to really implement the Binax rapid testing, antigen testing cards of 15 minutes. This is being done all over the states. People are doing home kits. You can test at your employer upon entry. And only if you test positive on that Binax card, then you go and get a PCR test, and you also self-isolate. You isolate and you stay at home. But we need a faster, more expedient, efficient way of testing and contacting people. And that is what the employers need, because imagine all of the work that goes into scheduling. And I'm not talking just restaurants, any employer, right? And I think that even Superintendent Fernandez said, how do you manage operations with this on a day-to-day basis? The same goes for any business, any sector, government, private, public, it doesn't matter. You have to manage your operations with as much information as possible, with as many protocols as possible. And the business community has been doing that. And if it's community spread, you can't target certain businesses. And so we are truly asking for reconsideration still of the 25 gathering and just going straight to 50% occupancy. Because as you saw in the reports last night, if hospitalizations are 19 out of 27 being unvaccinated, then the remaining is vaccinated. And so we're up to 30% vaccinated are in the hospital. So it doesn't matter because there's community transmission.
Yeah.
Right.
And it doesn't lead, it helps decrease the hospitalizations, yes, and that needs to be the goal.
Mm-hmm.
We all agree on that.
Yeah.
But how do you get there? You can't do it by excluding people and by limiting restrictions on businesses where you're really controlling their destiny of their revenue operations, their staffing, their hiring. Some people have been rehiring because of PUA, and we have to really plan this better and communicate better with each other. So we are really hoping that the governor, and I did, text the governor this morning, that I do hope, because of the JIC announcement last night, they reconsider gatherings to 25, and they put the 50 or 75% occupancy across the board, not to certain sectors.
That is so interesting, Mary, that the head of the Guam Hotel and Restaurant Association is asking for these restrictions, because I agree with you. If you look at just they always talk about the data, the science. Well, I mean, it shows that everyone is getting it. Everyone is giving it. There are vaccinated people in the hospital, right? So this whole, I mean, even the unrefined EO, I feel it did nothing to prevent transmission. It's like we're focusing on the hospitalizations and looking right through the crazy amount of positive cases that we have. And these measures
the revised EO did allow us to address the operational issues, right, of implementing this. So it allowed us to address how do they enter, and how, if public health can't issue these things for more than 5 business days, then you're really not allowed, you don't have a good system in place at this time to get people the documentation they need to either go to work and go be active in the community. And so that allowed us at least the consideration to have people self-attest. So that was done because they needed to answer the effectiveness, right, of their mandates. And then allowing us to do a different kind of test, not just a PCR test, I think was still a small win in the fact that she was still open to those things. Yeah. But it doesn't mean that, we still agreed on everything. We still asked for limit to 25 and go to 50 or 75% occupancy, which is where we were prior to lifting of restrictions.
Right.
And yeah, it's coming from GHRA because we've been active in all of this, and we all want the same thing. We want the same results. We would like to be out of this pandemic, and know that we have to live with this virus. And we need to be able to manage the community as well as the business in a reasonable manner, that things don't keep fluctuating from a day to day.
Yeah.
And we did really well when we were at 75% occupancy across all sectors.
Yeah, and I'm just going to go back to like her EO, both the EO, the first one and the refined one. To me, it just seems more like, let me do something to reach 100% vaccination, and not like, let me do something to put out the raging fire that is all the positive
there's
cases.
Truth to that, right? They want to increase vaccinations, obviously.
Yeah.
But you have to, again, balance all the priorities. And immediate, urgent priority is community transmission and the surge.
Yeah. Great.
No, I was going to say, how confident, though, do you think that the governor will take a really, really good look again at, or maybe...
A refined? Are we going to see like a refined
at that plan? Because I remember you came on. I think Dr. Wynn came on. Someone from Guam Contractors Association came on to talk about this massive plan that you guys had to do these rapid tests. Did you guys have to send it back over?
I think that's another way to, and it has to. I guess it comes down to. We cannot keep making quick decisions and reactive decision making. And we have to look at how can we really look at solutions that are comprehensive without identifying who was wrong or what decisions were made and who's to blame or whatever. It's not about that. It's really taking a step back with humility, understanding the situation we have, and really looking at the plan, right? So if DOE is allowed to practice their plan that they've had in place for a long time, why can't we? We've had these things in place for a very long time. These are our pandemic plans. And so why can't we go revisit our pandemic plan as we originally had it? It doesn't say that the governor was wrong. It doesn't say that the PAG was wrong or public health was wrong. It's just the situation keeps changing. It's fluid. And also our situation is worsening as we're seeing it. And if hospitalizations are the number and 1 out of 3 are vaccinated and 2/3 are unvaccinated, it's really not about vaccinated, unvaccinated. It's the fact that it's happening. And so we have to act. And with expediency. And that's why I'm suggesting that they change their testing protocols. Because by changing the testing protocols to the Binax, which we have the Binax cards here on Guam, it will only identify it much faster within 15 minutes and then save the PCR tests for those that test positive. It's just adjusting the protocols to meet the need of today with a sense of urgency.
So when are you getting hired?
Well, the governor asked me to work with public health on Monday. And the last couple of days, we've been trying to find time. I've made myself available since Monday. And I know that they're really busy, but we really have to address the testing protocols. It's not just because private sector wants this, because we don't want to send the employees to the community health centers or TEDSN to wait in those long hours. These protocols should actually also be implemented at the community health centers and TEDSN. So people aren't waiting for long hours, and then they can put, lines of entry is everybody get the Binax first, you triage, you get your results within 15 minutes, and then if you test positive, you go. And that is our protocol whenever we've done rapid testing. And, and even when we do immunizations, there's a 15-minute wait period to make sure you don't have any side effects. And so those protocols are all in place. And so it's just revisiting the plan and adjusting the plan as it needs adjustments at this point, right? And so I've made myself available. I believe Art and Shima are supposed to get back to me with regards to a time. I've made myself available today as well to go over this plan.
Okay, so guys, she's available, public health. Right here.
Don't wait till Monday.
And the governor asked asked, the governor agreed.
The governor
and
said.
that's why she made, in the language, it says test. It does not say PCR test in the revised plan. And so the goal was that we work together, public health with Surgeon Cell and GHRA, and we review this. And, you know, even the lab has offered to do the training on how businesses or other people can learn how to do the Binax cards safely and to report the results. So this is not something that we need, you know, the clinics to all get involved in, because the clinics have the PCR tests and other means with the Abbott machine, which also is a quick results, right? Quick in returning results is the Abbott machine that all of those clinics, tier 2 clinics have. The Binax really should be more for triage, like at employers, whether it's government or private sector, and then maybe the community health center in Teason. The clinics should probably just keep the Abbott machines going, because it also produces results very quickly as with the molecular machine that they have. So yeah, I'll continue to follow public health as the governor has asked us to do. And I'm sure I'll probably get a call today. So it's really important that we work this out, because and then also again, reconsider the recommendations made of 25 for gatherings and going back to occupancy for all sectors, not just targeting, you know, businesses, certain types of businesses that transmissions are not coming from.
Yeah. Well, there you go. That's huge. The head of the Guamatown Restaurant Association is imploring the governor to implement 50 or 75% occupancy limits across the board, and also limit social gatherings to 25. So that's,
and to change the testing protocols to have Binax 15-minute or Abbott 15-minute test results first before they implement PCR testing.
All right.
Wow, Mary, thank you.
Thanks, Mary.
Yeah, thank you very much, you guys.
Oh my God, I'm sorry. They should have done this from the beginning. This should have been the action. Sorry, Mary.
That's okay. I was just saying, stay safe.
Oh, stay safe.
Yeah, thank you.
Wash your hands.
Ah, there you go.
Anya, you haven't asked me if I'm going to have empanada in so long.
A little distracted from empanada. I mean, this.
My virtual empanada, because, you know, Chudley is just down the street from me. So.
Sorry, guys. I'm going to work on getting more virtual treats in the KUAM News Zoom room.
How about a virtual Binax test every week?
There you go.
There you go. That should be your quick question this week.
Thank you. It's 9:53. Okay. We're going to take a quick break, and we're coming back with more of the show. A little wrap up next right here on the link.
Breeze. The KUAM Podcast Network is back and on demand, featuring a great variety of podcasts from our island and region, including culture, lifestyle, awareness, crime, politics, commentary, comedy, and entertainment. Available on most streaming platforms. The KUAM Podcast Network. Subscribe and listen now.